Hello, welcome. Thank you so much for joining us today for this webinar about community mapping. Community mapping is something that I've actually been involved with now since 2010, which is when I first had the idea that it could actually be beneficial for people within communities. So here today is myself. I'm Jaki. I'm the founder of If Everyone Cares CIC that has created the UK's first network of connected area-based community maps. And also with us is Andy, and Andy is actually part of my support team, helps me. I'm dyslexic, so if any of you ask questions in the chat, then it's great for Andy to be here with me and support me so that he can read them out to me and then I can answer them to make sure I don't miss something. So welcome. Please do put things into the chat. Let's get started. So a little bit of housekeeping first. This is being recorded. It does not record the questions that are in the chat. If you want to remain anonymous, please, feel free, put your question in there. That's absolutely fine. But if you don't want us to say it, put a little asterisk and we won't use your name. We'll just say the question. That's fine. But nobody actually sees the questions, just the people that are here. So it is being recorded for later on. Health and safety. This is obviously an online webinar. If we were in a training room, we'd be going, there's going to be a fire alarm or things like that. Obviously, that isn't needed today. But obviously, if one goes where you are, please do leave. Please do keep yourself safe. Meet is a wonderful platform that we've been using for a few months now. We're still getting to know our way around it. But what you will see is towards your right, you will see that there's space for chats, for Q&A. We're not doing any polls today. There is one where you can actually raise your hand. So if you want to raise your hand and come up and ask the question on stage that obviously would be recorded, you are welcome to. At the end of the session, we're going to do a Q&A in here. But after that, we will make ourselves available. You go out to what's like a networking social lounge, and there are virtual tables there. So if you've got any questions, you can come in and join us on there, where you can put your camera on and your microphone. But that will not be recorded. That's not part of the recording. And at the end, also, we'll give you all the contact details so you can get in contact if you've got any questions afterwards. So welcome to the webinar. I've already asked if you could share things in the side so we can see that John's here, which is great. Jim's here. So now, Jim, sorry, how do I say that? Torfan? And you're interested in supportive and inclusive communities. Absolutely fantastic. So are we. And Ken is interested in overlays and behavioural aspects. Okay, I'd love to have some more in-depth questions from you on that. That would be absolutely brilliant. Thank you. So the who, the why and the what. Back in 2010, so why we got involved in community mapping. Back in 2010, I was a trainer and I was helping people who'd been out of work long term due to illness and disability to rediscover their confidence and self-esteem so they can move back into work. I loved my job until one day one of my managers told me a number of my clients were no-hopers and they couldn't come in anymore. And all we used to do was if there were free seats on future training things, we'd invite people to come back again and to be a peer mentor for new people coming through because it would help with their confidence and self-esteem. The one thing that I realised that I had seen for everybody I met, there were no exceptions, was had the people who came in actually found help and support at an earlier stage through the local community groups, charities, and other resources that were within their community, they probably wouldn't have got to the stage that they had got to in their life, which was actually crisis point for many of them. So some had lost their homes, some marriages had split up, some had tried to commit suicide, some were so isolated and depressed, their life, their quality of life, it left me not sleeping at night. So my question then was, why is this that people can't find and access this information? If you can go to Google Maps and you can find a hotel or restaurant virtually anywhere in the world and make an informed decision, then why can't you do that with the local community groups, organisations, places where people can connect and make contact with others, so reducing isolation, just the whole thing. Empower people to find what help and support is out there for them. And it may be they don't need help and support. It may be they just need contact with other people. And that could potentially be through volunteering. And that gives them a sense of purpose. And obviously, my background at that stage was about helping people to get back into work. So then what did I do about this being told people were no hopers, and then this behavior that people already had for going to Google Maps? How could I do something? So in 2012, I put the idea of creating an interactive community map that maps charities and community groups in the global Sir Richard Branson and Virgin Unite challenge to screw business as usual. And the idea was actually voted third from ideas from around the world. It was a 4-month campaign. It was very in depth. It was over 28,000 votes. So it wasn't just, this wasn't something that was just an overnight in this. We really were voted third with this idea. And we had people contacting us from other countries saying, when you've done it in the UK, please, will you do it here? We need it here as well. So we discovered that there really was a need. I didn't quite know how I was going to do it. So it started from that point, from having that feedback from people that it was needed. It wasn't just me thinking that it was needed and thinking I would do it. Actually, people were going, we need this. Why doesn't it exist already? So how did we do this? We started with simple conversations. Now, we didn't have any funding from anybody. So I think we were absolutely blessed because we didn't. Had we had funding from somebody, we would have had to have met their desired outcomes, and we couldn't have iterated and gone off at slight tangents. So we started with simple conversations, and we really listened, and we heard and we listened again, and we asked more questions. So if somebody said something in one conversation, we would then bring that into another one to see if other people felt that that was relevant as well. So we were iterating in this cycle of everything. We did lots of research and interviews with organisations that had tried community mapping in the past and had failed. Many of those were the community mapping that they were doing, and it was actually more like a directory. So somebody would need to go through and put in one filter and then another filter and another filter, and then they would just get one answer. We realised that by using mapping, if you go to Google Maps and you're looking for a restaurant, you get all the different choices. And so if this one that you came to that you think was the one you were going to like isn't the right one, you could have a look at others that were similar around it. So we felt that using the mapping and a behavior that people had already was the right way to do it. You weren't trying to teach somebody a new behavior, which is harder to do and harder to get people to take it on. When the pandemic came and the first lockdown came in, we started doing some really big soul searching on what we had heard from people. And we had already heard from people, this is having a UK-wide map. Sorry, my voice is going to go. Having a UK-wide map is fantastic, but actually we live in Weston-super-Mare. We'd like a map for there. We live in Bournemouth. We'd like a map for there. When we're people who live in a community, we would like that map to reflect our community much more. So we'd done some testing already. We'd already had 3 area-based community maps that we'd done testing on over the previous 18 months to see how they worked. And on the week that the first lockdown came in, we were doing our 4th map launch with Bournemouth University and students from there. So what should have been an in-person event turned out to be an online event, and it went down really well. And at that point, I got together with our tech and said, area maps are what are needed. The feedback that we were having is that's what we needed to do, but they need to be connected. You don't want to have everything disconnected. This is here in this part of the country and works in that way, and this is in this part of the country and works that way. But none of the information that organisations are putting on there can be accessed as an overall picture of what's happening across the country, which became very obvious during the pandemics, that actually had key decision makers been able to see what resources, what existed out there within the communities, it might have been really key for key decision makers. So we did a full rebuild. and we utilised multi-sites, we now have 93 area-based community maps, some with virtually no pinpoints on and some with lots. But we've worked out a system that can do that really well, and I'll tell you more about some of that as we go on. Please do ask questions, please do ask. To give you a little bit of facts and figures around why we believe community mapping is not only good for the people within the communities who we listen to, and every element has been built based on what the people in communities can use first, but actually can have a knock-on effect for local charities, key decision makers, government, as it grows. So there are over 150,000 registered charities in the UK, and there are even more community groups and places where people can connect and share, or resources, yet there is nowhere that brings all of this information together in one place so that it can be accessed easily. There's no single place that people can go, I can go here and I can find it. There's nothing that does that. And the aim of community mapping and the way that we're doing it is to make this possible. A report was done in 2016 by Eden Project Communities. It was commissioned by them. And it showed that disconnected communities were actually costing the country £32 billion a year. That's a huge amount. And every single one of those pounds is impacting the quality of life on somebody out in our communities. Whereas if they could find help and support, that figure would come down, communities would be more resilient, and people would be more empowered. In the same year, the Joseph Rowntree Foundation did a report that said that poverty was costing 78 billion a year. Now, I'm pretty certain that there's a crossover within that 32 billion and 78 billion. So I'm saying, but those are two figures that are both, not unsubstantial. So decisions, no matter who you are or where you sit within in a community or the country, whether you're that key decision maker within government level, within education level, police, NHS, local council, or whether you're the person in your community that is looking for help and support, or is feeling isolated, or has a member of their family that's got dementia and they're looking for where they can get help and support. Decisions for whoever it is, they are so much easier if you can see the whole picture. When you can't see the whole picture, everything is disconnected. So let's go back to that. Disconnected communities cost 32 billion a year. And I'm pretty certain that with what's been going on in the last 18 months, it's probably more than that now. So that's just one for you to think about. Community maps help to empower people. So we started the maps wanting to focus on the fact that it was for people in crisis. That was where I came at it from. And the more we did our research, the more we realized that not only did it help to empower people by helping them to have choice, to find help, to find volunteering, to reduce isolation, but also that each person is, it's a personal journey. If somebody is struggling and they're feeling isolated, which could lead to depression, they might go to their doctors, and the answer might be then to have antidepressants. However, if they've been empowered to find what's in their community, what they really need is to be able to reduce their isolation. There might be a local history group, which somebody else might go, well, do you really want that on your community map? Yes, of course you do. Because if that person likes history, they suddenly can go and join that group. They're meeting people. They might then go out for teas or coffees or whatever else, maybe with masks and bits and pieces on now, but take it in the context of overarching, not just around COVID. It gives people that option, and everybody's journey is different. When they have a crisis, when they need something, the solution for them is going to be different. And by bringing community maps together in a way like this, you actually enable people to find what the solution is for them. And it may not be antidepressants. It may be joining a local walking group. It may be volunteering at the local cat centre. It may be volunteering in general. It may be finding the local memory cafe that you can take a member of your family to, so that you can actually bring a smile back to their face. We never know. We realised that, let me go to the next slide. So I was just about to go off at a tangent, which I'm very good at doing, but let's keep to the format here. So some things that we learned is, I said that we did research with organisations that had tried community mapping and failed, and many of them had had very big budgets. They had brought people on, they'd had a team, the team had been updating, adding information to their maps or their directories. And within 6 months, that information was out of date and they needed to go back and make sure it was still accurate. And so that was sort of one area. So we do it in the way that organizations actually add their information themselves. They have full control over the profile that they do, and they only need to add it once and then come in each 6 months to update it. And I'll explain more about that in a little bit as to the system that we've got around it. So keep it lean, make it so it's not work heavy for any one organization. So keep a standard format to the profiles. The people that we talk to out on the streets and within communities that struggled, every website is set up in a different way. They wouldn't know where to go and find the information on a website. So the way that we've done it is each profile has its own standard format. Looks like a miniature website, but once you've been to a few of the profiles, you actually know where to go to find the relevant information. The next one was people out in communities told us, and actually even people within the healthcare system told us, that many directories that forced people to use filters when they were looking for things meant that people might miss the things that they really needed or that could help them. So we do it, the format within our community mapping is you can look at things, you can use filters, but you can actually look at it from the map side of things as well. You can see everything that's around. You can see the results in list format as well, depending on how you see things best. So traffic light systems. So I said just now that the organizations add their profiles themselves. One of the other big things that we heard from people out within communities and even people within NHS, social services, etc., police, that they would hear of an organization, they would know of an organization, but they wouldn't know whether it was still active. So they might forward somebody to go to an organization, and then that person might come back and go, it's closed, it doesn't exist anymore. We haven't seen any other organizations do community mapping in the same way that we do. We use a unique traffic light system. If a pinpoint on the map is green, it means it's been updated in the last 6 months. If it's amber, it's 6 to 12 months. And if it's red, it's over 12 months. Now, let me be honest, at the moment, there are more red pinpoints on the map than we would like. But I think everybody has been firefighting within their organizations. People have left within their volunteers and everything else. We're slowly going through and connecting to make sure that we're getting more of them to go back to being green. But it's a really good way of the person who is searching for help, no matter what their reason why they're searching for it or searching to connect, knows instantly whether the information that they found is more likely to be accurate. And that's a really key thing. We also learn in our research that there are 5 key things people in communities want to know. That is, who does the organisation help? How do they help? What difference does it make? What help do they need? And how do they get in contact with them? They don't want to know when that organisation was set up and that they've just had funding for this or that, and they don't want to know who the trustees are. When people are seeking out help and support or places to connect, or even organisations to collaborate with or support, so say a local business wants to support a local charity, they don't want to know who the trustees are. They want to know what's the difference it makes, how do they help, who do they help, and what help do they need. So across the board, those were the 5 key things people wanted to know. So we've integrated all of that into our mapping system. We realized that exactly the same data that was that we would be providing through creating the mapping to help people who were in crisis would actually help those struggling with isolation, those who wanted to volunteer. Could you imagine if this had been up and running on a greater scale at the beginning of the first pandemic and we had more organisations on the maps already? Could you imagine how people within communities, A, could have sought help, but B, could have found the organisations that needed their support for volunteering? How organisations could have connected with each other in a collaborative way so that they could actually utilise all their resources in a more effective way, cost-effective way, a way that had greater impact. The same data could be used for those within social prescribing, helping them to know what's going on in the community and where they could do it. Could you imagine if there was a touch screen in every doctor's surgery, every library, every hospital, every housing benefit waiting room, every school for children who were struggling, maybe potentially to find, if they're being bullied, what support is out there for them, you know? And the beauty that we realized, because we are not just focusing on crisis, which was the original remit that we had, somebody can be looking at the maps on their phone when they're on their commute, in the office, in a cafe, and nobody is looking at them and going, oh, you know, there's no judgment, because they could be looking for volunteering. They could be looking for any reason. And that was a really big bit of feedback that we got from people who were struggling with depression, with mental health issues, was that if they felt they would be judged by going on to something that was specifically for them, they thought they might not actually go on and use it because there would be a stigma. So it's also useful information for key decision makers. We had an amazing, you know, long conversations with people within the police in the area that we were in, and they actually said, could you imagine if when our officers go out around something to do with mental health and we could say, go to this website and you can see, and you'll instantly be able to see, to actually help to empower people. So we're the UK's first network of connected area-based community maps, and people can then find help. They can find where they can volunteer. Organisations can connect with each other to help collaborate, to encourage collaboration and maybe reduce duplication. How many times have you heard of charities and organisations that are set up 2 miles away from one that's fairly similar, and they've done it because they didn't realise the existing one was there? But also there's the ability, as this grows, imagine there's an organisation that sets something up that is absolutely, it is working hands down. It could be replicated in other parts of the country, but because people know what's there, they can actually go and find out information, connect with them. How can this be done in our area as well? How can we then tweak it to make it more appropriate? Because not everything is right for every area. The needs are different. And it's about connecting. It's places to connect with others in your community. So where are we at? First, network of area-based community maps. And when I say that, I mean it that you could go to one of our maps that is in, I'm going to say Weston-super-Mare again. You could then scroll on the map or pull the map, and you could go up to Scotland and you would see what organisations were in Scotland. It doesn't matter which map you are on. You might be seeing it for the area that you're looking at there, but you just drag the map, click update for the data that's on there, and you will see those organisations there. So if you live in Scotland and a relative of yours lives down in Cornwall and you're looking for what help and support you could maybe find there or where they could connect with people, you can be on the same map and you can go all the way down there because they are all connected. That means that an organisation puts their information up there on once and then they update it. They don't have to put it on 10 different platforms. They just have to put it on one platform. And it's like a miniature website. So smaller area-based community groups and organisations that don't have a web presence are actually using their profiles as a miniature website and linking them to their social media. And some of them who don't even have social media are using it as their website on its own. We have the ability. So there are 12 regions in the UK. We've identified 400 key areas that would be good to have maps on. Organisations add their details once. Say they're an organisation that actually covers a wider area. They can add their details once and then they can duplicate through a very simple system. They can duplicate their profile to go in other areas. Organisations can also hide their addresses. So say it's Women's Aid or something like that. They want to show they're in an area, but they don't want to give their actual address. They tick a button. It shows that they're in that area, but there's no address given. So it actually is quite secure as well. There are multiple ways that people can access the maps. So these maps can actually be dropped into any existing website. So say there was a partner organisation, a volunteer organisation that wanted to put the map in there. They do have to come to us because we have a really secure system where only organisations or domain names, URLs that we've given permission to can put one of our maps in, and we create that. It's a relatively easy thing for us to do. But these maps can be put into any website. So they can go into a bespoke website. They could go into, if it was social prescribing in the doctor's surgery and they wanted to have the organizations that they've verified that their support workers and people can go out and say to organizations, they can have that, and it can show just on their map if they want to, and their team can see it so they know which ones they can recommend. They can also be niche based. So for example, we're doing one with Plymouth Food Access Network. So it just shows all the different food aid organizations. It could just show, we've got one with a wildlife organization. It just shows all the wildlife ones. We've got the ability within these to actually do any of these things with the maps, and we're learning more and listening more to do them. They are so flexible and they're also secure. So I admit we're quite proud. I'll show you around the website in a minute as we get some questions. Only another couple of slides, I promise. Just to give you an idea of potential savings. So where I worked at the beginning, before this started, was in helping people who'd been out of work long term due to illness and disability. So I'm going to use an example of people who are unemployed. So we did some research and we updated the figures last year on what the potential savings were to councils, inland revenue and everything else. So somebody who is unemployed, the average cost of an unemployed person cross country is £15,401 per person. And that is based on, that's using the average of it, the average benefits of £217 a week. Okay, that is then taking, if they were to go back into work, it is based on a salary, I think it was 18,000. It might be on there, but I'm dyslexic and I'm trying to find the data. Oh, sorry, 19,500. So there's the figures there. Now, I said to you just now that we'd identified 400 key areas that we'd like to have maps in. And we'd like to partner with local councils, government organisations, NHS, police. We'd like to put maps wherever they are. They can be done and we can work in partnership with organisations, and we'd like to do that. But imagine for each of those 400 areas, if in a year, just one person from each of those areas who was unemployed found help and support and was able to move back into work. That is a saving of £6.1 million cross country. Now, it wouldn't be out of order to think that maybe 10 people per area, that's still only 4,000 people, could be supported to be able to then move back into work. You're suddenly talking about there is a saving of £61 million. That is not even thinking about the savings to doctor's appointments, social services, the fact that people are then bringing this money back because they're in work, they're bringing money back into their community. The difference in the mental health, the knock-on effect for people when they're back in work. There is a case for this being done, and this is only thinking about people who've been unemployed. The maps are there. They can be based on a niche if wanted to be, but they can also be no matter who it is. Impact. The potential impact is huge, but just in case there's anybody here who is within a government organisation, there's the United Nations Sustainable Development Goals for 2030. Community mapping actually helps with a number of these to lead to no poverty, no hunger. So if people can find that help and support, and they can find the places where they can go and join a walking group, there are so many elements within this and community mapping that can actually help with that. But then let's think about levelling up our communities. It actually helps to create a more even playing field for people. If people can find help and support themselves or a family member or whatever else as this grows, it's almost a no-brainer. If we had £1 for every time somebody said to us, why doesn't this exist already? Or doesn't that exist already? You know, it's logical. So it's easy for anybody to get involved with us. If it's a local charity, add a profile. Help spread the word. Become a partner for a map. So we're now working with our first local council. We're doing a pilot map project for 12 months. We're also working with Plymouth Food Aid. We're working with a nature project. We're working with a number of organisations as well on different maps, some of which I can't talk about at this stage because they're in progress. we're also doing a map with an organisation called Action to Prevent Suicide, and the goal is to create something called a map of hope that will show the places where people have actually been trained in safe talk and assist, to show the number of people who are out there who are willing to help and support. Because if it helps save just one life because somebody feels there are people out there to help, then that would be amazing. And just another little from one of our bits of research, and I will always remember this conversation. Somebody said to me who had attempted committing suicide in the past, and they said to me, just knowing this is there, Jackie, knowing that in those dark hours that I could go on the map and see the organisations that provide help and support might stop me from trying again, might help me to get through the next 5 minutes or even minute, and may stop me from doing that. If that's what this community mapping does, we've achieved our goal and more. If there are potential grant funders out there, there's a really easy way that you can help to support that would cost you nothing at all. If you are asking for people to apply for grant funding, ask them as part of their application process that they need to create a profile on aDoddle. So the community map is called aDoddle, so it's aDoddle.org. Ask them to do that, make it part of your application process. Or if they've got funding from you, they have to have one on there. Costs you nothing, but would soon help to fill the maps. Sponsor a map. Partner with us on a pilot map for your area. Tell us what you need. Learn with us, and we'll learn with you. We're always iterating, and we're always listening to feedback. Time for questions, and I'm going to be happy to stop sharing this. But hang on a minute. Let me give you this. I don't know if you know how to take a screenshot. We will put the details in, either Andy or Amber will put my contact details into the chat in a minute so you can get them. But please feel free to contact me. I'm open for any conversations around this. Okay. So any questions? Andy, can you help, please?
Yeah, no, I was just waiting for that bit where I came in. So yeah, I've got a couple in the questions in the Q&A section, but for those of you who've got a question, you haven't quite written it, pop something in either the chat or the Q&A and we'll work our way through them. First question though is, how are the maps published within a location?
How are the maps published within a location? Okay, I'm going to hope that I'm understanding this right. So we've got the area-based community. I'll tell you what, let me share my screen again and let me share aDoddle so that you can see. So I'm just literally choosing my screen, which is that nightmare of the ones to make sure you choose the right one. So now I can't see your screen. So Andy, may I double check? Is this now visible?
Yeah, we can see your screen. It's all good. Absolutely
fantastic. So this is the main aDoddle website. So what I'm going to do is I'm going to go over, because I've asked about the area maps. I'm going to show you that we've got the different regions. I am going to go down to the southwest because we've got the most maps in the southwest because we're located here. So for each one of these area-based maps that exists, we do a number of things. We have a system we go through. Please tell me if I'm going through too much of the technical, and that's not what you wanted to know. We have quite a secure system. We have to go through something called Cloudflare first. We have to give permission for, even on our own URL, aDoddle, our own domain, we have to give permission for it to be shown there. So we do that. Then we give a token for the map to be done. That's through another website that we have to, that we do that. So permissions are given along the round. We at the moment, with these area-based maps that are our ones that we're happy to partner with as well, we use WordPress multi-sites. We use our bespoke coding. We use Laravel. So we connect all of those in the background, and we then do a location from Google Maps. Somebody tells us somebody tells us what they want the center point of a map to be. We get the longitude and latitude, and we set that is, and we do all of that, and we give the map permissions to do certain things. So we can give it to show the traffic lights on there, which actually to date, everybody has chosen to use the traffic lights, not to use a different color for each icon, depending on whether it's older and bolder, mental health, physical health, whatever it is. So you have the options of doing that. And it's all set up through that. So let's go to let's just go to Exeter and show you. This is a page that is on, this is on one of our hosted partner maps. These maps can be dropped into any website when we've gone through the whole process. And you can see here then, so you can see you've got the green and you've got the red. You click on one of these. Now within one of these maps at this stage, it opens up in a modal within the map. We are working on a way so that it will open up in a new page so that it will take somebody to that as well. So let's just click on there. So here's one, for example, Spinning Top Toy Library. You can instantly see it's a green traffic light. You can see when it was updated, and this will take you to their profile. And this is actually really good, especially with the environment and everything that's going on with COP26 at the moment, is the fact that actually it helps reduce waste. You know, people can come in here and they can go and they can borrow toys from a toy library. For families that are living on the poverty line to be able to access toys that they wouldn't be able to access normally. This is a great one. I didn't know which one I was going to be opening up. So so here this brings you to a miniature website. Each of these becomes a tab to a different page. Okay, so let's go down and see what's in here. Tells you where it is, tells you the address. Now, if this had been chosen to be hidden, this would say this person's chosen to hide this address. There's a little bit of text that would come up there. So you can see that one there. Tells you the opening hours. So again, with the opening hours, we've got a really flexible way. They can put in each day, if it's the last Monday of a month, the first Friday of a month, only school holidays, they can put all of those details in there. You've then got the different ways that people can contact them. Our research has shown the more places that people put for contact, the better. Quite often people will come in, see the profile, like it, but say they're getting in contact with an organisation to find help, they will actually want to have gone to their Facebook page or their Instagram page to see what tone of voice they're using in it, to have the confidence to then get in contact. This will open up a get in touch button. So you've got the main information, you've got the what we do, you've got if they want volunteers, you've got a gallery with images and additional information. The first 3 tabs show on every profile. The next ones only show if the organisation has put information in there. Has that answered the question, or do I need to give more?
Yeah, to be honest, I think I've slightly misread Jim's question. He was talking about marketing in terms of publicised, but it was actually quite a good overview. So actually, this might lead on nicely to in terms of how are the maps then kind of marketed out into the community going forward.
Right, so at the moment, everything is done organically. We do have a relatively small budget with what we're doing, and we're concentrating on the bits that we can do. However, one of the things that we really want to do, and Jim, I'm not sure you're a manager of TCBC. I'm not quite sure what TCBC is, but if you want to put that in so I can tailor it a bit more. We are doing a number of things. So, for example, on 2 other maps that we've got at the moment, Coventry and Leicester, we're being sponsored for the map by Irwin Mitchell Solicitors. And so their sponsor logo goes here. They are saying about us in their newsletters. They are publicising it to their clients. And so it's going out to the list. So that is helping over and above what we do within our social media. That is going out through there. In the southwest or in Devon, we've also had bookmarks done, which have gone into Wales. Fantastic. We've done bookmarks that have gone into local libraries, so that actually people can go from the local library and they're more likely to keep a bookmark than a business card. And so that we found works really well. We'd like to get them done so that they go to doctor surgeries, hospitals and things like that as well. It's a relatively low cost thing to do, but it's also something that people are likely to keep. So we then work with partner organisations who help to get the word out as well. So actually in Devon, we've got a number of partner organisations. We've got Recovery Devon, which is around mental health, Libraries Unlimited and Devon Communities Together. And so by working with partner organisations, they help us to get the word out there as well. And we're learning all the time. We might not have it 100% perfect at the moment. However, we are getting there. And with people helping and partners coming on board and sponsors coming on board, it is really helping us. And our goal is that within 5 years that we have a large portion of the country covered. it makes it very lean. So Jim, you work for a local authority in Wales. Now I know Wales, and I can't remember the name of it. You've got an amazing directory up there. You really have, and there are parts about it that I absolutely love. You know, I really do. I think I'm very impressed. The thing about aDoddle is the whole country, it's connected. It doesn't matter where you are. So hang on a minute. If I zoom, hang on a minute, I've got to get this right. If I come here, so at the moment the pinpoints are only there for the area that I was on originally. But if I update, I suddenly see them there. And if I go out again, oh, it's not gonna, right. I think my internet connection is not fantastic. You can put filters on. So even in this, you can put filters on here. We explain here that filters can be a barrier to actually finding what you need, because sometimes you don't know exactly what you need. We actually suggest that people use a keyword first, because sometimes the keyword can be better. Again, this is all through research and feedback of what people have told us. And then you've got the choice of the filters and you can update them. So that's the area community maps. Let's go to here. Right, Andy, are there any other questions? I'll stop talking for a second.
Yeah, another quick question. It says, how easy is it for a community organization, group or charity to add their profile to the map and then obviously continue to update it?
Oh, so easy. It's like filling in a form. It really is. I'm going to really pray that my internet is good enough, because I didn't have that page open. So let's go here. Slow and steady. Right. I'm obviously signed into my account at the moment. I'm in the master account, so I've got everybody's one here. But if I click on this add to the map, which people can get to from here, so they can go create your profile now, and there's benefits of adding your profile. It is here. It is a two-step process. So the first part is simply a form. So you literally add it in, and this then turns into that mini website. So it literally takes what you put in here and turns it into that mini website. So it's the project's name, what the mission is. So for example, providing support within mental health or something. What type of project is it? So are you a charity, a not-for-profit, community project, CIC? You've got the choice. It could even be a community building. We found community buildings are becoming more and more because they hold so much in there that they do within their communities. And Andy, if you remember to ask me about the community buildings and the users of adding profiles and things like that, if you remember, that would be great. I'm so aware of the time. We can go out and go around the tables in just a bit. And Jim, I've just seen the comment in there. Yes, I don't know how to say that name, so I'm not even going to try and embarrass myself. But so it's literally this. You choose those. You choose what that one. If it's a charity, it will ask you for your charity number. You choose your filters. You choose as many as you like. If you've chosen more than one, you then get a drop down. So you choose which do you want to be the main one, which then becomes the icon on your pinpoint on the map. You tell us if they're free, low cost, subsidized. You pick as many as you want. It helps people to decide, because charged, some people can afford to pay, and that's okay. Then you think about, and this, we haven't got this in the search function at the moment, but we will have. Think about why somebody might be using to search it. Do they need help? Do they want to help? Do they want to connect and share and collaborate? You've got the choices there. Then you add all the different types of contact. So let's go website first. You would do that. Then you would go add another type. So I'm not going to put anything in there because of time. Put that. Then say I decided I wanted my email address at the top. I can change that round just by grabbing the three little buttons. You can add your logo if you've got one. Then your location. So this is based on sort of roughly where I am now. You can move this around, put it anywhere you want. So if it doesn't come up exactly where you want it to be, you can move that round. If you want it to keep the address that you had in there originally, save it the first time, come back in, move it, save it again. It will keep the original address in there, because sometimes mapping isn't as precise as people would like it to be. You can choose if you want to add it. Right, I'm in the master one at the moment. So if you had a partner map with us, you would have this ability to say that you want it on a specific partner map as well. So that's the possibility there. Terms and service add. That will take you to stage 1. Stage 2 is you fill in the details in those sections that I showed you earlier on. So maps, profiles do not go live for 48 hours, which enables us to double check that everything is all right with them. And also every time an organization clicks save, we get a notification. So longer term, we will be asking the communities to help police everything that's on there. But at this point in time, we actually, on the last time somebody clicks save, we go in and we double check that the content is there. Right, any other questions in the Q&A? Did that answer it?
I think they covered it. So I've got the one that says, I think we covered this anyway, but how are local organisations that have a local reach shown?
So on the map, it would be put the main point where you are, and then it comes up. So if we go back to Exeter, so if you imagine here, you know, this is Ottery St Mary. This is shown here for in the area of Ottery St Mary. The libraries need to go green. They just need to have a quick update. Budley Salterton, it shows in that area. And then you can zoom in and you can zoom out. So it shows where you put the pinpoint. So if it's just a local area, if it's a duplication, so if you've got your master profile that you've done, and then you've got maybe you cover 6 or 7 different areas, you can create the duplicates for that. I won't go into that in this moment, but it's a very simple process. We've kept everything as simple as possible to make it easy to use. You go in, you add those, it will duplicate the master profile, and then what it will do is you can actually go into each individual one if there's some slightly different information you want to add to it. When you update the master, it will update all of the others, but it will keep the different information the same as it is. It won't take that away for you. So it makes it really simple and easy to do them. I hope that answers the question.
Yeah, I think it's kind of in terms of like, you know, you've got your master one. How would probably the other ones show? Well, obviously, if it's a national reach,
As
I
a
don't know if
team,
it's I don't know if it's multiple locations, or I know they show as individual pinpoints, or whether if you only have like one location that covers the whole country.
then I would say if you've got one location, so in the filters, people can ask for something that is national, okay? But it would mean that somebody was doing that national one. So say you were actually something, so I'm going to say, for example, the Trussell Trust, because food aid is such a big one at the moment. For example, if you've got them in different areas, if it's available in different areas, or Ability Net that helps people with IT skills and things like that, you do your first one, but you then choose your first part of your postcode for different areas across the country, or where you want it to show that it is, and you put them on, and you just look after the one master one. Yes, we probably would say something if you were putting 1,000 pinpoints on the map. But if you're in different areas and you want to show that you're there and not take account of the fact somebody's looking for it as a national organization, which they can find through there, you can duplicate your profile. And I hope that answers that one. Any other questions?
So it says, so this is a free service that anyone can add their details to, assuming they pass criteria like being a volunteer org, for instance.
Yeah. So any organization that provides help needs volunteers. That yes does fit the criteria. I think in the 4 years we have only had one profile that somebody's tried to put up that wasn't appropriate. Everything else is fitted within, but as I say, 48 hours before it goes live, which gives us an opportunity to have a look, and we will get in contact with somebody if we think it's not right. But it's about providing an opportunity, a resource, help and support, somewhere for people to connect, somewhere for people to volunteer. So it's about those things that help people to be more connected within their community and support them. And it's free for them to add. Our finances come in through a different way, through sponsorship. In time will come in through licensing with local councils. And as I said, we're doing a paid pilot with a council at the moment, a 1-year pilot with a council that wants to be able to keep the organizations that set up during lockdowns and everything else, and not lose contact with them. So any other questions? So Jim, you've asked could the two systems link. I'd love to explore to see if the two systems could link. Feel free, please get in contact with me. Could I ask one of the team to please put in the chat my email address so that people could contact me? Thank you so much. Really appreciate it. I saw that one go in there really quickly. Now, we are officially, we should have finished a few minutes ago. We have the ability with this, if there are, if I stop sharing, if there are no other questions at this moment, I've got a little red dot on the Q&A. Does that mean there's a question in there? Have we answered all of the questions?
Yeah, I think that kind of covers it. Some were answered during the session, some have been answered obviously since. Sure, you were going to talk about community buildings, which you want me to mention briefly, but then I think that's it for the Q&A. But obviously, stick any last-minute ones in, or contact Jackie directly after the session, or pop into a table, and we'll be able to pick those up in a moment.
Yeah, we can do that. Two things. One of the things that we are working on at this moment, that's our tech development that we're doing at the moment. We are doing it. So say you're a master user, but you've got, so say, for example, the libraries that we had just now. You could be the master owner of the library's profiles, but you could give permission to person A for the Ottery St Mary one, person B for the Budley Salterton one. So you retain control over them, but say there was something locally going on, you can give permissions to another team member to be able to update them. You have the ability. So we're working on that. That was something that we were asked a number of times to do. That should be ready in the next couple of weeks. We were working on it all weekend, and we're just working on the user interface for it at this moment. We also have the ability for organizations. So say somebody was responsible for the profile, but now they're leaving and they need to hand that over to somebody else. We have a fully integrated system where person who's responsible at the moment adds the email address of the person who wants to be. They get sent an email with a code that's time limited to ask them if they're happy to take over that profile. Person A, if they decide they've sent it to the wrong person or changed their mind, right up until the point the person has taken over control, can cancel that invitation. But it is all done through a system, and the person has to agree to take over that profile before the whole thing goes through. But it can all be done very easily now. So what we're having with a couple of the organizations we're working with is they've got Kickstart apprentices who are adding information with permission of organizations first and starting the profiles, and then they are signing them over to the organization for the organization to then take responsibility for it. And it's working really quite nicely, but it just makes it that bit easier. Then community buildings, the same again, same system with that. The community building, the person of the community building could set up the one account, but then give permission through the users to be able to put in, that it's the mother and baby group, or the dad's group, or whatever else, or the community lunch for older and bolder, or whatever else. So it's giving more control over it and helping it to be more managed by organizations, but to be able to share the responsibility of profiles with other team members. So I hope that helps. We'll share the slide deck. Oh yeah, could do. Nobody's ever asked me that before. Could I ask you, Matt, because believe it or not, we won't get your email addresses. The email addresses will go through digital leaders. And the reason that we're one of the digital leaders talks is actually digital leaders named us on their digital leaders 100 list for potential social impact with that. And we've won a couple of other awards, which I'm really proud of, but none of it would have been possible, A, without the amazing team we've got, which is only a small team, but B, without the organizations who are taking the time to add their profiles and to update them. Because without that, there is no map. We can create the tech, but if people don't use it, we found last year, and we did have one campaign that went out, we had nearly 500,000 page views last year. It's slightly less this year because we haven't had a big campaign that went out. But yeah, the number of people who are finding the maps and the feedback that we're getting is amazing. So if there are no more questions now, what do we look for in a partner organization? An organization that's committed to doing this. For some partner organizations, we're working with them for free, but it has got a monetary value. Take the concept of 3 packets of sausages. There's one that's free, there's one that's £2.50, and there's one that's £5. Which would you go for? Some people say they wouldn't go for the free one because they'd be afraid they were taking it away from somebody who really needed it, or they, whatever, and the middle one and the other. just because we're prepared to work with some partners, if you can prove to us that you're going to do this, we've been stung before. We've gone to work with partners. We've done all our work at our end, and they've done nothing at their end. And so show us that you want to be a partner. It would have a value, and please respect that value, because we are paid that by some people. But if you want to try something with us, get in contact. If you've got a big budget, please decide that you want to give us a little bit. But if budget's the stopping point for not doing it, come to us. Give us your case, tell us why. So we look for somebody who's going to be committed to helping to make this work, to spread the word, to get it out there, to get organizations on there, maybe to get a Kickstart apprentice to help put them on in that area, someone who's well networked, somebody who believes in the fact that this can do something and is not just going to use it as a 5-minute flash in the pan, can see the long-term benefits for their community. So I hope that answers it. I'm going to say a huge thank you to each of you for attending today. I'm going to end the session now, but we're going to go out into the networking tables. So please do feel free to come and join us at a table. We'll be there for about 15 minutes, and so you can come in. Thank you so much for your time. There will be a recording of this. And Matt, if you anybody who wants the slide deck, please email me your information and I'll send it to you. And we'll put the link up to the video as well. Thank you ever so much. Take care. Bye-bye.